My name is Kim Nettleman Fish. I became aware of COVID as I planned to visit my kids in March of 2020. David works in San Francisco, and Lauren is an MBA student in Chicago. Before flying to California on March 6th, I grabbed a surgical mask and put a few Lysol wipes into baggies. A mom move for sure, and my kids might tease me about it. My flights were uneventful, and I felt a little silly with Lysol wipes stashed in my purse. David met me at his apartment. His backpack was bulging with his computer and other gear. We're mandatory work from home for a week, he explained. His girlfriend was wondering how her PhD research would continue as Berkeley went online. I suggested stocking their apartment with groceries. We were thrilled to find Lysol wipes, which had fallen behind a shelf, and shocked by the long checkout lines. All across the city, from Chinatown to the normally bustling financial district, things were starting to feel strangely quiet. At the San Francisco airport on March 10th, the change was inescapable. Very few people were traveling. There were no lines anywhere. After boarding my flight, I wiped down my seat and my tray table, and this time I didn't feel the least bit self-conscious doing that. But when I landed in Chicago, I was stunned. The airport there was busy. The CTA train was full. I arrived at Lauren's apartment during a discussion of whether her upcoming trip to Colombia might be canceled. I urged Lauren and her roommate to fill their freezer, and they humored me with a trip to Aldi, where we found no shortages. But a mere 2 days later, the grocery stores had empty shelves. I felt like I was in the movie Groundhog Day. By the time I headed home to Springfield on Friday the 13th, Lauren's classes had moved online, Trump said he was closing our borders, and of course the Colombia trip was canceled. In mid-March, Ohio imposed a stay-at-home order. Schools closed, toilet paper was scarce, and meat was rationed. We baked and ate way too much banana bread. We had wine with DeWine and appreciated Dr. Amy Acton's fact-based briefings. The stock market fell, and we started thinking differently about our savings and our bills. My husband was consumed with questions about his medical practice. Larry is an ophthalmologist. Most days he sees dozens of patients and examines their eyes with his face only inches from theirs. The stay-at-home order and limited supply of masks led to an emergency-only schedule, with only one doctor working part-time each week. And Larry and his partners and his practice manager walked a tightrope, caring for patients while minimizing the risk of COVID infection. The doctors went weeks without pay and then reduced their salaries so they could provide a safety net for their employees and still ensure the survival of their business. April was a blur of countless phone calls to the accountant, webinars about unemployment benefits and loans, and interminable stress associated with sorting it all out. Meanwhile, my work as part-time as a philanthropy advisor continued, with phone calls replacing meetings. I was in a good place for what I thought would be a month or two of restrictions. I severely underestimated the scale of this disruption. As spring turned to summer, I learned to avoid places where people don't mask, and I became brave enough to ask people to give me space or mask up. I worried about my husband's exposure as a frontline healthcare worker. I worried about my parents' health, and I worried about the toll of social isolation. I had moments of overwhelming fear, but I am in a fortunate situation. My family is healthy, we have a comfortable home and financial reserves, and we aren't trying to educate school-aged children at home. We've helped a few friends through unexpected cash crunches. We've donated to organizations that help our struggling neighbors, and we've ordered takeout to support local restaurants. Zoom calls became a part of life. We visited nearby parks and trails with our dog. We rode bike paths and quiet country roads. We struggled to celebrate my dad's 90th birthday in August. We shrunk the party, we stayed mostly outdoors, and then we held our breath as we all waited for negative test results. While my husband continued his work, I began to realize how non-essential I am. I've tried to play helpful roles, mostly from the confines of home. I worked the election for my first time, filling in for high-risk poll workers who had to stay home. When the health district hired me to help in their COVID response, I became a minor player on a hard-working team. As fall turned to winter, my patience began to wear thin. My lockdown life was harder to maintain. I began to wonder how to balance risk with my desire to see my kids and to be outside in warmer weather. When my husband and brother were among the first to get vaccinated, I began to imagine life after COVID. In mid-December, I reached a point where I just wouldn't stay locked away any longer. I booked a flight to California, and I tested negative twice before the flight just to be safe. Surprisingly, the evening before my flight, I became eligible for a vaccine left over at the end of the day after the health district's first vaccination clinic. I'm acutely aware that others are more at risk, so I asked, can my father or my sister-in-law, who's a nurse, get it instead? But when I learned that these doses were restricted to health district staff, I signed up. The shot was painless, and I walked outside into the empty parking lot that night, overwhelmed with gratitude, relief, and joy. The next day was a quiet travel day. I flew to California with my parents to help them settle into their winter home. My husband worked on Christmas and then flew out. Our kids tested negative, and then they joined us. As December 2020 ended, I was grateful for every moment, much of it outdoors, with my healthy family.